In our society, the need to better the environment of those less fortunate than us is a concept that is taught to children in schools and pushed to adults through all forms of media. While this is a noble and charitable concept, it often leads to solutions that don't take into account what is being taken from those performing the services. The best example of this in the health system today is the concept of universal healthcare. In theory, universal healthcare is a fantastic solution to the rising cost of healthcare. But if you want just one example of the way a government-run healthcare system would function, we will just need to look at our programs such as the VA. The VA is a costly example of just how insufficiently bureaucrats run things. As stated in the article, History of Universal Healthcare, we should run from attempts in our state to decrease competition in the healthcare system and increase government dependency, leaving our healthcare at the mercy of a monopolistic system that does not need to be timely or responsive to patients. The government's total control over the healthcare system would lead to less competition and encouragement to create a better system for patients, because no matter what, they must choose the government-run facilities. Whereas in private systems, there are multiple options for patients to choose from, causing hospital systems to always strive to be better than the competition, or else they might just lose business. When you have an entire system that is going to be run and funded by the government, you get a drastic spike in taxes. Either way, you will be paying for your health care. In the article Universal Healthcare in the United States of America, A Healthy Debate, it states, there is indeed agreement that realization of universal healthcare in the U.S. would necessitate significant upfront costs. Universal healthcare includes the potential for general system inefficiency, including lengthy wait times for patients and a hampering of medical entrepreneurship and innovation. Where would these funds for the upfront costs come from? What other government-run programs would we have to take funding from? These are the important questions to ask before implementing. In the same article as above, it states, though the majority of post-industrial westernized nations employ a universal healthcare model, few, if any, of those nations are as geographically large, populous, or ethnically/racially diverse as the U.S. Different regions in the U.S. are defined by distinct cultural identities. Systems have unique religious and political values, and the populace spans the socio-economic spectrum. This presents another issue when trying to create a system that caters to hundreds of different cultural views and religious views. As a patient, you get less say on what your insurance plan will cover and not cover, unlike with private insurance. With multiple plans and options, you can pick the one that meets all your needs and values. In conclusion, while in theory, universal healthcare is a great concept, when you put it in action, it hurts more than it helps. A better option would be what the country has implemented now, a mix between government-funded insurance, such as Medicaid and the VA, and private insurance, such as Anthem and Medical Mutual. This also gives people more options and freedom while also supporting those in financial hardships.